Remember SGLT2 inhibitors by the story of a runaway train due to a delirious train conductor going through glucose withdrawals. Sodium glucose cotransporter 2 inhibitors are represented by a transporter train with a 2,2,2 on inhibiting chain tracks. SGLT2 inhibitors end in the suffix glyphosine, represented by the Cliff zone. Examples of these drugs include canagliflozin, empagliflozin, and dapagliflozin. They work by blocking glucose reabsorption in the proximal tubule, shown as the Blockman glue bottle and P-ROX. They are indicated for patients with type 2 diabetes mellitus, shown as the dyed bead pancreas in these cars. Now, there are a few side effects of these medications that are worth mentioning. Since SGLT2 inhibitors cause glycosuria, the fluid loss can cause weight loss, the skinny man with baggy pants, and lowered blood pressure, the down arrow blood pressure cuff. Hyperkalemia is another side effect, the Hiker banana, as well as urinary tract infections, the bladder and kidney inflames. SGLT2 inhibitors are contraindicated in patients with chronic kidney disease or an eGFR less than 30, the Crohn kidney caution tape. So to recap, SGLT2 inhibitors are anti-diabetic medications that end in the suffix glyphosine. They work by blocking glucose reabsorption in the proximal tubule. Side effects include decreased blood pressure, weight loss, hyperkalemia, and urinary tract infections. They are contraindicated in patients with severe chronic kidney disease.
This delirious train conductor is about to run off a cliff. There are only a few feet of inhibiting chain tracks left for the transporter train in 222. He can see the drop below off the cliff zone, but is so delirious from his glucose withdrawals that he isn't slowing down. Down below, a blockman is working on removing these P-ROX for construction to continue building the highway. He uses his glue bottle to help clear the rubble. These two dyed bead pancreases are racing down the highway and see the terror right in front of them. Everyone on the train jumps off before it flies off the cliff edge. This skinny man with baggy pants is terrified for his life, but gets his pants caught in the down arrow blood pressure cuff. It's unfortunately too late for this hiker banana who couldn't stay on the cliff because the flaming waterfall of bladder and kidneys is washing him down the cliff. Meanwhile, the Crohn kidney prepares for a delicious meal of human remains as she hides in a cave under the cliff. She has bolstered caution tapes to ward off trespassers.